Karen Watchman, Professor of Aging, Frailty and Dementia at the University of Stirling. And today what I'm going to talk to you about is the contents of the guide. So we'll look a little bit more deeper at what's actually included and why that might be. So I'll just share my screen. And you can see here the themes that are included. So these are the different sections that you'll be able to find within the guide. And key themes throughout are that person-centred approach and that there is choice as far as possible. Knowledge, skills and training, multi-agency collaboration, the environment, physical health needs, and meaningful and purposeful engagement. And we stress from the start, as we do throughout today, that people with a learning disability and dementia should be supported to live in their own home for as long as they wish. We're not advocating a care home move as a first or an only option, but we know it happens, and we also know it doesn't always work well. So we really need to address it. And just to say that staying at home, aging in place is the best thing for an individual is really not enough, because we know it doesn't always work. And we need to look at what enables that to happen. And if it doesn't, how can we plan for other options that may include a care home? But let's just take a brief step back and look at some of the evidence. So in 2004, a report by the Joseph Rowntree Foundation highlighted that a lack of planning and resources resulted in people with a learning disability and dementia being inappropriately moved to care homes for older people. So if we fast forward to 2023, we still see those crisis moves and the lack of involvement in future planning. Accommodation needs, staff are still looking for training and information. Recommendations in 2004 included systematic training on learning disability and dementia for staff in care homes, and that continues to be a challenge. There's a situation of reinventing the wheel whenever a resident with a learning disability moves into a care home, with existing staff not having built up that knowledge or confidence previously, and new staff not aware of where to access information or how to provide support in a care home context. The existing solutions don't cross the sectors of both learning disability and dementia, which is what we've tried to do in this resource. And we need to remember as well that this isn't just a place to live. Ultimately, if this is to become home for someone with a learning disability and dementia, this is a place they will die too. And advancing dementia is not the same as end-of-life care and shouldn't be responded to in the same way. I'll just start with a conversation I recently had with someone who has a learning disability and dementia, and who said that they didn't want to move to one of them places. And by that, he meant a care home. This became apparent as we talked some more. And this person had spent an significant early part of his life in Lennox Castle, which for those of you not in Scotland was a long stay institution, out of town institution. Long since closed, of course. But to him, we're talking about large congregate settings when a care home is referred to. So why would this be any different? So really important that we understand the perception of the person with a learning disability, not just about dementia, of course that's important, but also of what the available support might be, what it means and what it does not mean as well. It's really important that we have that communication. So drawing on that focus of individuality, there are different ways that a person can be supported. And it might be as part of setting their own goals and plans, or being supported to decide their own preferences or later life preferences or healthcare needs and wants. And we acknowledge that. And you're probably thinking, well, yeah, that's the same for all of us. But In terms of what might be different for a person with a learning disability, remember that if someone's moving to a care home from a family home, for example, especially in a crisis situation, the person with a learning disability will have less experience of living independently and may not even have met the criteria for support from services or social work previously. So that communication is really important. That's so effective communication, building on pre-existing communication methods and preferences even before dementia. So many different types of approaches and very individual how we work with the person. But the quote here, there are quotes throughout that are taken from the guidance. There should be a transition plan to help support and prepare for the new environment. And really important as well that this move isn't service driven. If someone can't navigate the stairs in their current home, or that's given as a reason for a move to a care home, then the new room in the care home shouldn't be upstairs. I often hear the importance of the lack of waking night staff as a reason for someone to move. So if this therapeutic support is identified as needed in the current home, then it's also needed in a care home. So really important to think about the individual and their needs. In Scotland, all health and social care staff working with people who have dementia are able to access 4 different levels of training through the Promoting Excellence framework. And this includes core educational resources, training programs, but none of the available material currently focuses on dementia in people with a learning disability. Recognising that people with a learning disability will of course have other health conditions as they get older, number of comorbidities, and that need for ongoing assessment as dementia advances further is really important, and not just in relation to dementia. People with Down syndrome, for example, might experience late onset seizures, and really important that that forms part of training so that staff are aware of that. And of course, we've got staff or family members listening today or listening back later who are not in Scotland. So have a look at your local and national context. The Scottish Government has just completed a consultation period for the next dementia strategy in Scotland. And members of my research team who have a learning disability and dementia were able to give feedback as part of that consultation and really felt that their voice was listened to. So do the same where you are, and let's make sure this issue and the support required is heard loud and clear. So certainly we're trying to do that in Scotland at the moment. And back to knowledge, skills and training, care home staff during the process of developing this guidance told us that their training needs were around that intersection of learning disability and dementia, but also around learning disability more generally. This was really strongly identified as a need even before we add advancing dementia. So fundamentally, what does it mean to have a learning disability? What are the different types of learning disability, and what are the differences before we even start to look at what might be different about supporting someone with a learning disability and dementia? So the training needs came through really strongly. Other needs were end-of-life care for this group, and also understanding changing communication needs. Physical health needs and the environment is another theme that runs very strongly throughout. Now, you might look at this slide if you're from a dementia background and think, yeah, this is really familiar. So dementia-friendly design, calm, predictable, making sense, suitably, but not over-stimulating, meaningful, purposeful activities. multidisciplinary approaches, you might be looking at this from a learning disability background and recognising some of the importance here. For example, when you've been used to supporting someone with autism, there are some similarities here. But actually what we need to look is through the lens of both learning disability and dementia. So let's just look at the top one, for example, dementia-friendly design. If you imagine someone with Down syndrome who is not typically very, very tall, and so you might have signage up to help navigation, cues for how to use the building or the room, or how to find different spaces in the building. But if they're not at the right height, then they become ineffective. And that applies to a number of the principles around dementia-friendly design, thinking about the height, perhaps vision differences. So yes, the multidisciplinary approach is important. That communication between sectors is really important. And the things we've tried to capture here are things like the importance of routines, of communication, keep coming back to communication, greater understanding of complex needs and autism. And we provide tips and suggestions throughout the guidance that we've been told have worked previously for some people. And just the example of someone with Down syndrome is one example. There's another one on the screen. It might be helpful to recreate my bedroom in the home as much as possible to help me feel safe and secure and settle into my new home. So the transition period might be different. The transition process might be different. But just think about how helpful it is or not, depending on the individual, for the person to have regular visits before they move. And that process might not be the same, and we need to be prepared for that. So a couple more quotes here. I must be supported to exercise my human rights. I should be enabled to take positive risks, to continue to enjoy, to do the things that I enjoy and that are important to me. And my care home must balance what's important for me with what's important to me. But also, as part of this process, we need planning knowledge. What is your local population, including the age of family carers, as well as the age of people with a learning disability, the number of people with Down syndrome, and their age too, remembering that dementia is likely to affect people with Down syndrome at a younger age. And our long-term vision in developing the guidance is that care homes throughout the UK will welcome older people with a learning disability and dementia into an environment where staff are trained and confident to provide appropriate support. And of course, we've only been able to give a snapshot today. So please do take time to look at the guidelines. We want to know how you use them. We want to know how they work. Other areas that are covered include commissioning resources and registration. Bearing in mind, of course, there are differences across the UK, so we haven't covered some of these areas in depth today. But what we've tried to do is to identify support, and throughout the guidance, we also identify resources to consider. Should a move be appropriate? Now, we know there are still gaps, and we're looking at ways we can address this. And primarily, that would be around supporting the choice of people with a learning disability and dementia, and how we know what someone wants from their care home. You've possibly engaged in a number of training activities yourself, thinking about what should the care home for the future look like? What would my care home look like? Do we ask that question of people with a learning disability? I think the answer is no to that, but it's certainly something that we need to start and find out. So we've highlighted that there's still some way to go. There's a lack of research around people with a learning disability and dementia in care homes, but certainly, even more pressing, we don't have that clear means yet of enabling people with a learning disability to say what they want from their future accommodation, and that voice still needs to be heard. So thank you very much for listening, and I will stop the presentation there. And please do keep in touch and let us know how you use the guidance and suggestions for future work. Thank you.